Good afternoon. Thank you so much that you've, giving this your time to us and to speak to people on the show. Find out a bit more about the new centre and also why you got involved, within brain tumours and research and things like that.
Okay, we go back a long time. So I started working on brain tumours back in 1971 in London, and I went through a few places there. The National Hospital for Nervous Diseases, it used to be called. Then it was called the National Hospital for Neurology and Neurosurgery. I worked for some time there. I worked in the Middlesex Hospital Medical School, and then later on at the Institute of Psychiatry at King's College London in South London. And then I came down here to Portsmouth in around 2003. So at Portsmouth, we've been doing brain tumour research since 2003. I've been doing it a lot longer. Helen has been working in the field for a very long time as well, and we were bumping into each other at various medical and scientific conferences over the known world over a 20-year period, I guess. And then when she sort of intimated that she wouldn't mind coming to work in England, then I was very, very keen to recruit her to the lab here. And so she's been here for 2 or 3 years now, and we're moving forward quite rapidly. Yeah. So it's been great.
Am I correct that you are actually originally that you used to live in Croydon?
I lived in Croydon for quite some time when I was working at King's College Hospital and in Denmark Hill. I was based at the Institute of Psychiatry campus.
I see. There's many of us that go. Well, I've been there many times, and I know that a lot of the people that go for chemo and things like that, they do actually go to King's College. And I don't know if it's just for the chemo section or whether it's just for other parts of why they're doing their treatment and things. So the
surgery is based there as well, and in fact we have a ongoing relationship with King's College Hospital because they send us tissues, biopsy tissue, which we then grow in the laboratory, and we study those patient tissues here as part of the collaboration that we have across the South region. So we have something called the South of England Brain Tumour Alliance, which is 7 centres in the South of England that are collaborating. All of those centres work on brain tumours either from a diagnostic, a therapeutic or a research standpoint. So about 3 or 4 years ago I decided that it was a good idea to pull these centres together into a collaboration. So we have a website and we have active collaboration between those centres, and so we continue our relationship with...
Yeah. What's the website that you have?
It's www.sebta.org, O-R-G.
Okay. And am I right that actually your mother wasn't very well, and that after you'd actually gone into looking at, studying with brain tumours and things, is it correct that your mum passed away from a brain tumour?
Yes, that's right. So this was a good while ago now. I was working on brain tumours. I've been working on brain tumours for about 8 years. And she phoned up one day with quite clearly the signs of a neurological condition, and I was able to facilitate her being seen by some experts who were friends of mine in London, and she was diagnosed with a malignant glioma, and she survived about 16 months with what was the current state of play medication then, which was resective neurosurgery followed by radiotherapy and then followed by chemotherapy, which was then 3 drugs called procarbazine, vincristine, and CCNU, PCV. But that's been superseded now by an agent called temozolomide. So most patients who are diagnosed with malignant brain tumour are treated after their radiotherapy or during their radiotherapy with a drug called temozolomide.
Yes, that one's come up a lot with people we've spoken to and have been on the show being interviewed. Whatever it is. I can't say it.
Temodol in the United Kingdom and in the United States.
I always say that obviously many of us that have been affected by brain tumour, our speech is not always great and we can't always remember certain things, and yet they pick the longest and hardest words to pronounce, and we're all like,
You have to speak the right language to understand it.
Yeah,
so
yeah.
Try to communicate in whatever language is best. Not always scientific language.
And the University of Portsmouth, where you're doing your research, do you rely, you obviously rely heavily on the funding that Brain Tumour Research do for you. Can you explain why it's really important that people do go to charities that fund research?
Yes, I mean, I think we're very fortunate in being the first of the Brain Tumour Research Centre. So there's a charity called Brain Tumour Research, which incorporates a number of other charities which have their own specific remits, but they act collegiately to push this field forward so that we have more resources to work on brain tumours throughout the UK, not just in Portsmouth. And the game plan from day one was to try to establish a number of centres across the UK. The number that we came up with, sort of plucked from the heavens really, was 7 centres initially. And the idea is that there is a critical mass of research workers there who are working in a dedicated fashion on brain tumours, nothing else but brain tumours, and that the charity sector would provide core funding for the establishment and the success of those various centres. Relatively recently, just a couple of months back, we were had the very welcoming news that 3 more centres were being established. So these centres were already places where there was active brain tumour research being carried out, and those centres are at the University of Plymouth, at the Peninsula School of Medicine and Dentistry, headed by Professor Oliver Hahnemann. The second one is at the Queen Mary London, which is part of London University, and Bart's Hospital, and that's headed up by Professor Sylvia Marino and Professor Denise Shear, along with Professor Sebastian Brandner, who's based at the Institute of Neuro-Oncology at University College London. And then the final one is at the Imperial College and Charing Cross Hospital campus, and that's headed by Mr. Kevin O'Neill, who's a consultant neurosurgeon there specialising in brain tumours. And so we now have those 3, plus a centre here at Portsmouth, which Helen and I are running here and have been doing for a few years now.
Yes, that's a massive investment, though, on behalf of brain tumour research, isn't it? It's not just thousands; it's millions of pounds.
The game plan is to support each of those centres to the tune of £1 million a year. That's on a sustainable basis. So the way this works is that initially the charities work together, they bring some money in, and they pump prime. So they bring a certain amount of money in, which enables us to appoint some key positions, to have some running costs there, to make sure that we can afford all the reagents we need to run this laboratory-based research. And then they bring fundraising folks into the local area. So here in Portsmouth, we've got an active fundraiser, and the job there is to, first of all, badge the activities here for brain tumour research, so engage the local community in community fundraising, and then go to the corporate sector and bring in corporate monies, again from that sector. And that should be on a sustainable basis. So eventually, £1 million a year should be coming in specifically from the locality where the centres are based respectively.
Right.
It's wonderful.
Yeah, it is. It's really good.
The game plan seems to be working very well at the moment, and we're all very enthusiastic. I think without this charity sector funding, there would be little or no brain tumour research in the UK, because the funding sources have progressively been diminishing over the years, not only the renewed activity of the charity sector, that we're seeing more investment, and that's really quite an amazing feat within a very few years.
And another important thing is that it allows us to compete grant-wise in other funding opportunities like government-sponsored. So we're able to really, based on that foundation funding from the charity, we're able to get state-of-the-art equipment, state-of-the-art folks, and we can write proposals that can help us be self-sustaining.
Right. Sorry, we didn't introduce you as well, Helen. So anyone listening, you're listening then to Helen Fillmore. Professor Pilkington did mention her at the beginning of the interview, and you both work together down there, don't you, in Portsmouth?
That's right. We have 18 staff in the group who are funded by either Brain Tumour Research, the charity, or the associated charities, and we have pulled in some other funding from different organisations to bolster up the staff numbers. So we're doing very well, and it's probably numerically the biggest brain tumour research facility in the UK now, which is quite encouraging.
How often do you get to meet the patients, as in the people that obviously the drugs are ending up? How often do you actually get to meet them? I know other people that were doing a trial over in America, and I know that they never saw the people that actually made the drugs that have saved them. I just wonder, how often do you get to meet people?
Well, pretty often. Maybe not as regularly as when I was in London. was in London, there was a multidisciplinary team meeting there, and I used to be part of that. So I would meet patients when they were actually going through their diagnosis and their therapy and so on, and that was a fantastic experience to go with them, as it were, through that care pathway. We don't have a hospital here on our doorstep, so the nearest clinical neuroscience centre is just over in Southampton. Though Southampton's quite close, it's about a 25-minute to half an hour trip over there. So although we've had discussions with the folks over there and we get on very well with the neurosurgical team and so on, it's not a regular occurrence for us to attend those MDT meetings. However, we have lots of patients coming in here. We are very happy to show people around. In fact, this evening we have a group of 12 people coming around for a visit to the labs. This is done on a monthly basis. But we also have ad hoc visits as well, when people, if they want to come along and find out what we're doing, or they have specific questions about tumours, maybe just to help them to communicate with their clinical teams, just to get a basic understanding of why a tumour is being treated with a particular agent, or what the biology of the brain tumour is, and so on, just preparing them for that discussion with their clinicians.
I definitely think the more understanding you have, then the more, I mean, the brain is such a huge thing to understand, but I think the more you do get information, the more it's also quite nice to get to just understand it a bit more.
Understand what's happening.
Yeah, because when you first when I first found out that I had a brain tumor, I was like, what? Like, what is that? Where is it? And where in my head? And apparently it was everywhere. But it's nice to understand exactly what's happening. So I would love to go there and obviously see and come and meet you all and find out more as what's going on, and it'd be wonderful.
Well, I just think it's nice if I mean, are you undergoing any new trials or drugs at the moment? Or is it more just to do with researching tumours and how that... Because the other thing is, people don't know why they happen. They just do.
Okay, so I mean, finding out the causes of brain tumours is like looking for a needle in a haystack. And that would be a very costly exercise. We don't concentrate on that side of things. There are people called neuroepidemiologists who undertake those sort of studies, but that's not our lot. What we do is do basic science research in the laboratory. All the work that we carry out here is using clinical samples. So we use brain tumours which have been biopsied at the time of surgery, and we use that information to try to get a continuum of what we're finding out at basic science level, and then translating that towards the clinic. So there are lots of steps to tick off bit by bit before you get into a clinical trial. And we're looking at new approaches, so we're looking at things like gene therapy, where we're trying to modify existing structures within brain tumours to try to get the tumours to, in a way, cure themselves or repair themselves. And we're also looking at new drugs and old drugs for new purposes. So one of the big areas at the moment is repurposing drugs which have previously been used to treat other conditions, other medical conditions, which we use in the lab to find out whether they may have some other utility in treating various types of brain tumour. And we've got 3 or 4 of those that we're also very interested in. So, yes, we're interested right the way through, from the molecule to the cell, to the tissue, to the brain itself, and ultimately to the patient.
I definitely think you've got one of the hardest jobs in the world, because as I say, they say brains is one of the hardest to understand, one of the hardest. So I do think you've definitely got a challenge.
And you actually don't seem to have lost your enthusiasm either. So I mean, you obviously really enjoy the work you're doing.
Well, I think Helen and I like working together because we're both very passionate about brain tumours, but we're enthusiastic because we get enjoyment from doing the work. And so that stimulates you, but it's also very, very sort of humbling to work with patients, very closely with patients, and with clinicians who have difficult decisions to make about their patients. So I think that whole experience is something which really is in itself sort of enlightening and fulfilling. I know Helen probably has something to say on that. I know she's very...
One of the great things about coming to work with Geoff is we do share a passion to move the field forward and pick up the pace. And I came from a background of molecular neuroanatomy, and was kind of my motto is I love the brain, but I hate cancer. So 20 years ago, I started studying brain tumors and met up with Geoff at different meetings, and we have a shared passion to translate what we know on the bench, what we learn from the bench, to patients as soon as we can.
Yeah. And the other centres of excellence, do you all meet up every so often, or do you keep in touch just over social media and on the emails and internet, or do you actually all meet up every so often?
No, we meet up quite regularly. The Neuro-Oncology, the brain tumour field, is actually relatively small. There is a national society, something called the British Neuro-Oncology Society. I had the privilege of being the president of that for 2 years and finished that role about a year ago, just under a year ago. So we have a national society where people get together. There's an annual meeting, but we also communicate and collaborate with individuals across the UK. There's also a European organisation called the European Association of Neuro-Oncology, and I'm on the executive board of that currently as well. So we meet with people across Europe. And then there's an equivalent organisation, although quite a lot bigger than the British Society, called SNO, the Society for Neuro-Oncology, which is the American society. The Americans, and I'm sure I like to give a bit of a dig to Helen, because the Americans don't feel it appropriate to call it the American Society, they just call it the Society. But so we get to that meeting as well.
Yeah. Helen, are you from America or are you from Canada? Are you from America? I don't know why, I thought you were from Canada. Which is probably about...
I'm originally from America.
Oh, okay. I won't say Canadian then.
But to answer your question, we, as well as those official channels, and we have probably 6 meetings that we're going to this year with various members of the group are going to different meetings, so we're collaborating and communicating through that sort of media. But we also bump into each other quite regularly, so the people who are leading those other 3 centres, I've seen all 3 sets of people very regularly, and the last time I bumped into some of them was about a week ago. So we are in very regular touch, and we try wherever we can to communicate, but also to collaborate. Have active collaborations within between those centres and between the individuals there as well.
Brilliant.
No, that's really good, because one thing that comes across quite often when people are talking about not research but charities, they don't seem to talk to each other, and they're all, after the same end, but they're all doing their own thing. It's really nice to know that you all collaborate. You're not all out for just Portsmouth or
for everyone,
Plymouth or London. It's a collaboration, which is really good. And somebody on our shout box has just come in, Panda, and said she'd really like to visit. It sounds really interesting. And I'm sure there are other people that would
want to come down and have a look and hear more. Yeah, I'd like to. So, yeah.
It's easy. We can certainly accommodate that. As I say, we have regular visits which are scheduled. So these are one a month, and they're either in the evenings or the afternoons, and there are 1 or 2 at weekends as well. So we've got dates there. If anybody's interested in that, then please contact us. I think you have the contact details.
Yeah, no, I'll definitely get the details as well for everyone. Yeah, and we'll let them know. And I know that Brain Tumour Research will do that as well. So, no, I think, I'd love to go.
One thing that did come up in the press release that came out when the centres were announced, the other 3, is that promising scientists will be trained up to fulfil their potential, and rather than being tempted into other cancer research, which obviously at the moment attracts a lot more funding. But I thought that was quite good, because it's good to encourage younger scientists.
Absolutely. And this is one of the reasons why I was really passionate about getting these centres up and running, because what we had before was a sort of a hit or miss system, whereby we would get a 3-year grant in to appoint a PhD student. That PhD student would spend 3 years, we'd spend a lot of time with them, training them, they'd become very good at what they were doing. And then they would try to get a postdoctoral position, and those weren't there. So they'd have to jump ship between perhaps working on brain tumours to working on another form of cancer or to another form of neurological disease, but they couldn't get re-engaged in brain tumour research. So this channel of funding that's coming in is enabling us to train people up, and then if we have multiple centres across the UK, we can cross-fertilise between those centres and give the young folks the experience not just to succeed in Portsmouth, but also to move between centres within the Brain Tumour Research funding, but also further afield within in the UK. If more centres are being set up, and we can also send them across the world. Helen's just passed a bit of paper across to me here, which says cost. This doesn't mean to say that we need money for everything. What it is, there's a European Union grant call, which is called cost, and we recently applied for some money with another 18 centres within Europe. Wow. Three of the centres, one of them was in Slovenia. The people who've been leading it are in Heidelberg, and we're the third centre. But the idea is to bring money in to enable us to meet at regular intervals in each other's laboratories and in each other's cities, and to send young folks across between those different centres to gain more experience and to diversify a little bit in their knowledge bank.
Yeah.
So I think this is really important, that we engage more of the young folks and we train them so that the rungs on the ladder are there. Hitherto they've been missing, and unfortunately people have dropped off the edge, and I've had 30 odd PhD students studying under me over the years, and a real handful of them are still in the discipline. Most of them, unfortunately, have had to move into different fields.
Right. So Brain Tumour Research is our charity of the month, and we're really pleased that they came up with such great people to interview.
Yeah, really, we were so excited when they said it. And
it's really, everyone on our shout box is enjoying the
listening.
interview. Yeah, Melinda's on there now. She says enjoying the show. As I say, Panda earlier on said, I'd love to visit. Most interesting stuff.
I think it's many of us that have been affected. We would love to know more, so that even if you've already, you've gone over, the tumours are taken out or anything like that, or you still want to know more because you want to have a bit more of an understanding as what's happened to you. And then if you've got any symptoms, or not symptoms, but any side effects as such or anything, it is really comforting to have a bit more of an understanding of the whole thing.
It's quite a complex area because it's not like most cancers. There are very few types of cancer which affect each organ in the body. In the brain, there are over 120 different types of tumour. Yeah. And increasingly, we're finding more and more not just about what the tumours look like down the microscope, but we can also use molecular information to subgroup those. And those subgroups are proving very useful, particularly with paediatric tumours at the moment.
Yeah.
Be able to put them into different groups, not just to work out more personalised therapies for each of those subgroups with better results, but also to avoid having the same, perhaps toxic treatment regimen to all patients. So we can reduce the toxicity, and therefore the quality of life of patients will increase, as well as the survival times and the cure rates. So all of this molecular information is beginning to translate into something which is really incredibly exciting and incredibly powerful in enabling clinicians to make decisions based around the molecular nature of each patient's tumour. And we're getting closer and closer to this, hand-picking cases and then treating them with different forms of medication.
No, it's encouraging.
Really exciting from our standpoint.
Yeah, definitely. It's really encouraging.
It's also encouraging for patients as well to know that,
There's many people we do know that have a grade 4 or anything like that, and obviously they're just wanting something, even anything. So any kind of this kind of, understanding is brilliant.
Yeah.
Thank you so much for taking your time, taking the time to come and speak to us.
And please
come visit.
Put people onto the Brain Tumour Research website. There's plenty of information there as well.
Yeah, no, definitely, and we'll keep telling people. So, I'm really looking forward to seeing it and coming to meet you.
Yeah.
So, okay, thank you so much.
Bye-bye.
Bye.
Thank you. Bye.